I will often say when I teach leadership courses, one of the foundational lessons is connections before content. Doesn't matter what it is you're doing. If I connect with people, I learn a little bit more about them and what's of interest to them. And in fact, then, we can actually achieve shared goals much, much easier.
All right, well, welcome to the Hat Rack. It's Dr. Bill McCauley speaking, the Associate Dean of Continuing Professional Development and Faculty Development at the Schulich School of Medicine and Dentistry. We're recording this session in February. I'm in London, Ontario. Our guest is in Ottawa. And I don't know what it's like in our nation's capital today, but here it's a beautiful, bright, sunny day, which is always something that elevates your mood in the middle of wintertime. And speaking of elevating your mood and feeling good about yourself, today's topic is physician well-being and the intersection and interplay between continuing professional development and physician well-being. So I am so delighted to have a guest with us that's known internationally. Her name is Dr. Mamta Gautam. And Dr. Gautam is a psychiatrist at the Ottawa Hospital and the University of Ottawa as well. She's an internationally renowned clinician, consultant. She's an executive coach. She's a researcher, a speaker, an author, and she's an expert in the area of professional health, professional well-being, and professional leadership. She's committed to advancing diversity in medicine and facilitates leadership development for women in medicine. And in fact, she's developed and co-leads Momentum, which is a retreat for women in medicine, and founded The Raft, which is an accredited online platform for physician development, in particular, women physician in medicine. So, Dr. Gautam, I know the political climate in Ottawa is kind of blustery right now, but hopefully you're having a bright sunny day up there, and welcome to the Hat Rack.
Yeah, thank you so much for having me here today, Bill. And like you, we're enjoying a beautiful sunny winter day. And I have to just add, as a plug for Ottawa, the canal skating has never been better. So we've just had a fabulous winter, lots of great snow, lots of great conditions for ice in the canal, and really able to enjoy this winter. Thank you.
Yeah, we've had a real winter this year. I think the canal had been down for a year or two, or not very good. Is that right?
Absolutely. Like 2 years ago, I don't think it opened at all. And last year for a fraction of what we had hoped. And it's perfect this year.
Great. So maybe I provided a little bit of a brief and somewhat scripted introduction to her. Why don't you just tell us a little bit about yourself, and then maybe how it is that you got yourself interested in the physician well-being part of your career?
Yeah, thank you so much. As you mentioned, I'm a psychiatrist. I trained in psychiatry here at the University of Ottawa. And then I went on actually to do a fellowship in child psychiatry. So that's what I thought my whole career was going to be. And I actually enjoy telling the story because it's one of those sliding doors kinds of things. Like I ended up doing the work that I do by serendipity. And I was in my, first few months of practice after my fellowship, and I got a phone call late one Friday evening from a friend, a mentor of mine, who that year was the president of a national medical organization, and they were having their annual meeting, speaking of CPD here in Ottawa. And I get this panic call at night because the keynote speaker for 8 o'clock the next morning had, become ill and had just canceled. So, she's like, what are you doing tomorrow? And can you fill in? Now, remember, this is like 1990. I'm kind of fresh, starting in my career and haven't done a lot of presentations. And we don't have PowerPoint or anything like that allows you to just kind of pivot, very quickly. And so I remember, I'm speaking to her on this phone that's, still connected to the wall back then. And I look over on the sideboard in the room, and there's this slide carousel. And perhaps some of our listeners might not even know what I'm talking about, but this was an antiquated way that we used to, give presentations. We'd actually have hard slides, and you had to make sure you put them in properly into this round tray, the carousel.
Yeah, full of Harvard graphics slides,
exactly,
probably.
Exactly. And upside down and backwards, so they would, project the right way, and you had to think of the order in which they came, all of that stuff. And, it was a pretty it was a pretty laborious process to get your carousel ready for a presentation. So all of that to say, I looked over at the sideboard and I said, you know what? My carousel is ready for depression. I've just finished teaching the residents, and I'm happy to to adjust it to tailor it to the audience. But can I talk about depression? And she said, I don't care what you talk about, right? I just need a warm body
I need
tomorrow
a warm
morning.
body.
And so that's actually how I had this unexpected opportunity to speak to hundreds of doctors about depression. And at the end of it, I, very touched to be able to share with you. I had several colleagues come up to me, about 3 or 4 come up and say, we really liked your approach to depression. It sounded like you were telling my story. Will you see me as a patient? And within 3 months, by word of mouth, that was my whole practice. So
this was not a presentation that you had prepared about depression in physicians. It was just a generic presentation on depression that you were going to give to the residents.
Absolutely. Now, I did tailor it. I talked, I used some personal stories. I used some stories of, friends and colleagues and mentors with their permission and
Sure.
disguised. But at the end of the day, I tailored it to what it would be like to work in medicine and experience that. But absolutely, it was really about, it was just literally a pre-formed presentation on depression.
And so then I think you had said that within 3 months or so, word got out and you started to build up a practice of physicians in practice that were suffering from depression and probably other things as well.
Absolutely. And, it was, I think, really important for people to feel like there was a safe space, for people to feel like, somebody they trusted had found it helpful. And so really, I think the word of mouth made a big difference. And for me, really to recognize, right, that there is this huge need. And I think at the time, what we realized was, we did have physician health programs at different provincial medical organizations, but at the time, they were mostly focused on treating addictions. And so suddenly tapped into, as you said, stress, anxiety, depression, all these things that, colleagues were experiencing and had not really had any place to go to for support at the time. And so very, very rewarding. I realized into that a few years that there was a certain amount that I could help colleagues with in my office, one-to-one, and certainly that there was an impact. However, a lot of the drivers of the situation in which they found themselves was really the culture of medicine, the healthcare system in which we work. And that is, in fact, what led me to expand some of my work into physician leadership development, hoping that if I could have more physicians become leaders in the healthcare system, then we would have a greater impact on creating healthier medical workplaces.
Okay, so your desire to get into the leadership side of it was with the hope that you could improve some of the systemic problems that we see that so significantly affect our physician well-being and burnout and that sort of thing. That's fascinating.
Absolutely, yeah.
So how did you then make that transition from a clinician to a leader developer?
Yeah, so very interesting. I didn't fully transition into that and, continued my clinical work as well. I think, and a lot of times, the presentations were more, Friday, Saturday, Sunday, because, as most physicians, work hard during the week, don't have the opportunity perhaps to get away for CPD, for those kinds of things. And so a lot of that, the training or the courses often were, at the end of the week or weekends as well. So I was able to continue my work as well and incorporate that, although just, busy, of course, adding all of that in. Mm-hmm.
Which would have the potential to add to your own struggles and potential for burnout, I would think.
Absolutely. And I think, certainly, I had the privilege of hearing my colleagues and understanding how, we all share some very similar traits in terms of being very responsible, trying to do our best, achieving a high level of excellence, feeling the importance of being conscientious, of wanting to keep everyone around us happy and achieve at a very high level. And I think certainly a lot of my work with colleagues also, of course, applies to me personally. And, just watching people make some changes, recognizing that these were doable and more importantly, important, right? And then for me, I think perhaps the added responsibility, if you will, of recognizing that, as I become a leader in the space, that I really have the opportunity to be a role model. And it's important that I modeled some of what I'm, asking and advising colleagues to consider as well.
Right. So you started out your journey with a CPD event, which is a great segue for us because that's what we're talking about. How do you see that CPD can, I think CPD has the ability to support and to contribute to physician well-being, depending on the way you look at it, because CPD is something that we, for the most part, want to do, and I think we recognize that we need to do it, but we also have to do it. Okay, so there's some sort of a requirement for us to do that. So how can you see the CPD enterprise sort of supporting physician well-being?
Yes. I think, as you've said very nicely, nothing is sort of the perfect solution. I think there's lots of positive things about CPD that can support physician well-being. And, obviously the most obvious would be CPD that focuses on physician well-being so that, if we are actually doing courses on, on mindfulness, or if we're doing courses on, doing a presentation about some of the concerns and challenges that physicians have, and offering some very concrete strategies on how to address those, they do help, right? I think it is a bit of it is a bit of a two-edged sword though, because doing that takes time. Doing that takes energy and resources. It takes you away from some of the other things that you want to be doing. And so that in some ways can add to that level of stress, right? And so it's really looking at, finding that right balance, I think, for what what we're offering is really meeting a need. I think other CPDs that are not, of course, focused just on well-being and are focused on other kinds of content can also be helpful to us in terms of our well-being. When I think about well-being, and perhaps it's a good time for me to share this with you, but, over the years, I did some qualitative work in my practice to look at what is it that physicians do that helps support their well-being, that helps them stay resilient. Perhaps, when they were struggling as they came to see me, that helped them regain their sense of well-being and resilience, and then what helped them maintain it. And I was able to identify 5 clear themes and what I call the 5 C's of resilience. So the first is a sense of control. I would say, the biggest source of stress is when we feel like we don't have any control, or we don't have any choice in what we do, how we do it, where we do it, that kind of thing. And so the control is going to be very important. I think that as we start to recognize what we can and cannot control, focus on the things that we can control, that makes a big difference for us. Another C is our level of commitment. What is it about the work that we do that is really our why, right? What's our purpose, and how is the work meaningful to us? And those of us that stay connected to the purpose of the work we do, again, are able to, better manage their levels of stress. Another C would be connections and caring connections. That would be our colleagues, people in the workplace, the relationships that we make there, as well as our personal life and the people in our personal lives that are really important to us. And again, how do we stay connected to them and receive that energy and that support from them that will allow us to thrive in the work that we do. A fourth C is calming. So, how can we recognize that there are times where, we're going to be impacted, we're going to react to what's going around us. We might not be at our best, but how do we understand and identify that, and then have some really good techniques to help calm ourselves down? And whether that is, mindfulness or relaxation or exercise or getting out in nature. And then the fifth C is self-care in terms of eating, exercising, doing the things that sleeping, doing the things that we know are good for us. And yet we just, sometimes we mean to do them, but there's all this other stuff we have to do first that we don't always get to that. And what I see is that the colleagues that do really well are doing something in each of those 5 areas of life. And so, as I knew we were going to have this conversation, Bill, I was thinking, wonder how we could use that framework to design CPD, right? To have CPD that would then be supportive of physicians and their needs, right? So, how do we look at offering people choice and control, right? What is it about CPD that they can choose, that they can control? I think that, for example, we, certainly through the pandemic pivoted to, online courses, and there are, again, pros and cons of that, but it does offer people some flexibility. Some of the more long-term CPD courses that I'm involved in, particular, say, like leadership courses with a year-long cohort, we use a hybrid model. And, some of the courses are online, some of them are in person. And so I think that how do we give people some choice and control of, what they're going to come to, how they're going to receive that information, how they might be able to interact. So I think that's an important part. The other one, commitment, right? I think that, if we can offer topics that people are interested in, right, that really speak to their level of commitment. If my commitment is excellence in patient care, then I want to stay at the peak of my knowledge, and be able to know what is current knowledge and best practice in terms of patient care. And so again, how can I ensure, if I'm creating a CPD, that people get that is really the goal of offering this, and that the content allows people to stay connected to their commitment and offers that sense of meaning. Similarly, connections. We think about, and one of the difficulties that I've heard about the online, being on Zoom all day, types of courses, is that it prevents me from connecting with people the way that I would like to. And despite the cost and the time and the effort involved in going to in-person courses, we're seeing, colleagues really enjoy that. And I think what they are enjoying a lot is that sense of connection, is meeting people that, that they enjoy spending time with, and being able to learn from each other and support each other, and just that level of collegiality that you don't get when you're online with each other. And then calming, right? So you think, how can we create CPD events where, people have an opportunity perhaps to relax. People have an opportunity to go for a walk at lunchtime, and, you can head out into a beautiful space that you can go to and just relax, or, a space where you can do a mindfulness exercise, or even build in some of those things into the CPD. So how can we add sort of opportunities for that calming, and then the self-care as well, right? Can we put some thought into, as I say, giving people opportunities to do some activities that we know are good for them, building some of that self-care into the program, just even thinking about the food that we offer. And is it healthy? Is it nutritious? Is it something that we know is going to help sustain them for the day, right? And so I think, so as I was thinking about that framework, I thought, I wonder how we could best apply it to CPD.
So I think that is brilliant, and there are so many things that I want to pick up on what you just said. First of all, we are seeing among our clients, and I think it's the case throughout the country, that people are wanting to get back together again. So people are sort of have been there, done that attitude about the online learning, and really enjoy that ability to connect. The second thing is that a recurring theme on this podcast that's come from many, many guests is the importance of peer interaction in terms of learning that allows you to, or motivates you to change your practice behavior. So we tend to change our practice behavior based more by what we see our peers doing and what we learn from them one-on-one, as long as it's practice-based, more so than what we learn at a conference or from online learning. So we need to have the validation of the peers whom we trust and respect in order to do that, and that's built into your model. I love the thought of developing a CPD framework that's based on those 5 C's. And honestly, I think you should advocate to the Royal College and the CFPC to think about using a framework like that as the basis of their building their CPD requirements for accreditation. I think they would eat it up. So I think that's awesome. One thing I want to pick up on, another C word, is culture. And part of the culture of medicine is resilience. This is a framework on resilience, and I think that has the potential to have negative consequences in that there's an expectation that physicians are resilient. So we have to do anything that we can to make ourselves resilient. And being resilient is kind of the opposite of being vulnerable, which to me anyway says that if we have to be resilient, then we shouldn't show ourselves to be vulnerable. What do you think about that?
And, I'm not sure I ever sort of put those things together about resilience, not being vulnerable, but I do, I appreciate that. And certainly I see this in my practice a lot. And I talk about it less, I guess, as vulnerability, but even, so anything short of I am functioning at my best all the time, right? And this is the culture that we work in. It's the culture that we train in. Actually, let's even go back a little bit. It's we choose people into the culture, right? So we think about, when we do interviews for medical school, we choose people that are hardworking, that are conscientious, that are highly responsible, that, strive to achieve excellence. And we bring them into our culture where all of that, their teachers, their training, even our patients, reinforce our being like that. And part of the culture that I see, Bill, is sort of the stigma. And I guess that might be a little bit of what you're referring to in terms of vulnerability, right? That, the stigma of illness. And it's the sense of, you are supposed to be there for everybody else. You're supposed to sacrifice your own needs. You never show any weakness, never show any vulnerability. And interesting, as I work with colleagues, not just, for sure, I would understand the stigma of mental illness. The stigma of mental illness is within society as well. But even for us, even the stigma of illness, as somehow because we're doctors and we're supposed to stamp out illness and wipe out disease and never get sick ourselves. I remember really coming home to me, I remember a colleague saying in my office that as an emergency physician, she was going through her whole shift. It was a 12-hour shift. By about 10 hours into it, she had admitted, I think, 3 patients who had been undergoing a miscarriage. Before it, she was able to tell her colleague that she was working with, what, I've been actually miscarrying this whole shift as well, and I'm not feeling well, right? That's how long it takes. I think of a colleague who was diagnosed with a brain tumor, a very serious aggressive brain tumor. And, which is why he started to come to see me to get some support through what he knew was going to be a very challenging time personally and professionally. And I remember the next time he came in, I asked him, I said, so, how are your colleagues doing with this? And, what are they doing that can help support you? He goes, oh, I haven't told them yet. And I said, what do you mean? He goes, oh, well, I just, waiting for the pathology report to come back so they'll believe me. You think, this expectation that people won't believe you when you're sick, when you're seriously sick. And then, just escalate that even further to a diagnosis of mental illness where I have an anxiety disorder, or I have depression, or I have a bipolar illness that I'm going to need to learn to manage. And I need the support, right, of my colleagues to help me with that. And so hard to do. People are, very reluctant to disclose that. And realistically, people have had experiences where others have not been that supportive. And, I will actually say nowhere is the stigma of mental illness greater than within medicine. Right. We are very hard on each other.
Right. So I think we've identified that there's a need to develop the Gautam framework of well-being focused CPD for physicians, and that's something for organizers to do, for CPD offices and for the leaders in CPD, such as at the Royal College and CFPC, to think about ensuring that there's a focus on those wonderful elements that you discussed in our CPD. What can individual physicians do related to their CPD to help to support their well-being?
Yeah. So I think a big one is really to understand, sort of the benefits of CPD, right? And I think that, sometimes, and particularly certainly as we're going through the pandemic and we're, dealing with the aftermath, right? I call it sort of this perfect storm where, there have never been more demands and the resources are probably at their lowest, and that's where it is. And so in that environment, I think a lot of physicians aren't even thinking of CPD, right? Are just kind of, I don't have the time. I don't have, it's going to be really hard for me to organize this. I'm barely home with my family and I can't sort of get away, anymore. I think, so I would say, a big thing for the individual clinician is to remember the value of that, right? And actually just to build it in. To make sure that, to think of, okay, so, what are the kinds of programs? What is the content? Perhaps where are the people? And, you did speak, Bill, about the importance of, learning from our peers and peer-led workshops and that sort of thing, which I think is great. But I'll just add another sort of point of connection is really just going to a conference, knowing that you're going to meet up with a colleague there, right? I don't have to learn from them. I just to hang out with them. And that actually helps me fill my bucket. So I think, just kind of just knowing like which are those places where where the content is amazing for me. I get to see and reconnect with peers on a regular basis. And really come back feeling like that was a great investment of my time and energy.
I like your focus on peers because I think that one of the things that we don't do both systemically and individually as physicians is recognize more broadly what CPD is and where it's taking place, so that when we have a hallway conversation with a colleague about a patient and you gain some insights and you then change your practice behavior based on those conversations you've had with your insight, that's some of the most powerful CPD that we can do, but we don't recognize that. We don't think of that as CPD, and our certifying bodies, the Royal College and the CFPC, don't particularly think about that as CPD. At least there's not a way for us to sort of get those credits for those things, even though they're important. So I think physicians individually need to broaden the way they think about CPD to understand, hey, I just learned something, and I need to recognize that I did that, and I need to be proud of that, and I've changed my practice based on that little interaction that I had, because that happens all the time.
All the time.
Right. So I think trying to incorporate that into our mindset is something that we need to do, and maybe our structural partners need to help us to do that a little bit better as well.
Right. And
I wanted to ask.
I was just going to say, part of it is that the hallway conversations are so short, right?
Right.
It's a 5-minute conversation. How do you capture that? And can you capture that? And I was just going to suggest that, a way that I've done it with great success over the years is really to have a journal club, right? So I have a group of 12 psychiatrists, and this once a month we meet and we do that. We do update with a natural journal article as a journal club would, but then we have this opportunity to just share cases, with the appropriate level of confidentiality, but just to say, here's something I'm thinking about, or here's something I'm struggling with, or can I run this by you? And we get all of those, and multiple 5-minute little quick conversations and consultations from each other that do allow us to go back to our practice. And so we can sort of capture that in sort of as part of that journal club format. But it really involves, right, a venue where you come together. Right. To have those conversations. Right. And I guess that's what I was saying. That's part of what these, meetings and conferences are as well. So, there are some places, so I have got my journal club, but there's lots of other colleagues I admire and respect and really enjoy spending time with that I know I'm going to be speaking with them too, right? And getting that
I must say, I always come out of those interactions, one-on-one interactions with colleagues, feeling better for lots of different reasons. One is just having a professional conversation with someone that knows my world. The second is that it does give me the opportunity to say, I need help here. There's something that I need some help with, and it is invariably okay with that colleague that you need some help and they want to offer you that help. And that you always almost always go away from those interactions feeling a little bit better. So they do support well-being in some ways. I want to just sort of build on the peer stuff because you, in addition to your journal club, you have Momentum, which is your women's retreat, and you have the Raft, and those are all community-based learning activities for women in medicine, but that essentially follow that connectedness theme. Can you tell us a little bit about those things?
Yeah. So thank you for mentioning those. And absolutely. And I think it's because I just so believe in the power of connection. And I will often say when I teach leadership courses, one of the foundational lessons is connections before content, right? So it doesn't matter what it is you're doing, the importance, of connecting. If I connect with people, I learn a little bit more about them and what's of interest to them and what they think is important. And I recognize that we have some shared interests. We have some shared experiences. We have some shared values. In fact, then, we can actually achieve shared goals much, much easier. And so it's really about those connections. And so building on that, and I firmly believe in that, it's about bringing people together. And yes, there's a lot of education that is given and received, and also recognizing that peer teaching that we learn from each other. I'm certainly not the only expert in any of those spaces, and creating that opportunity for a community, right, and the connection. And I think whether it's those hallway conversations you were talking about, or these kinds of experiences that I've been privileged enough to organize. I think it's about creating that sense of safety, right? And that where, and we think about psychological safety and this environment, right, where it's safe to be included. I want to come back to that because I find there are some big conferences that we organize where it's intimidating to even go into, right? So I'm not even sure if I'm included in that. So that's sort of that first step, but beyond that, once I'm included, is it safe for me to ask questions and learn and not feel like, if I ask that question, they'll be like, Mamta, like, don't you even know that answer? Or like, we thought you were more competent than that, right? So safe to ask questions and learn. And then it's safe to also contribute and share each other's experiences so we can learn from each other and even challenge, right? Ultimately, I'd say, well, that hasn't been my experience. This is what I've seen. And I think it's part of getting to know people as people and creating that safety for learning.
Right. Yeah, that certainly in large group conferences, that takes a fairly confident and resilient, I guess, person to get up in front of the microphone with 1,000 people sitting in the room and ask a question, right? Because who wants to get up there and sort of in front of your colleagues feel like you are asking a question that you should know the answer to or something like that? I think
I was going to say, and even if it's not like that public, I will say there are many, many times where I'll walk into a conference room and I'll think, if I were not the keynote, I would be scared to be in this room right now, right? And because as a keynote, people come up to me and they know who I am and they'll ask me questions and they'll, guide me along. But if I'm just attending this conference, nobody knows and nobody cares, and you kind of have to make your own way through.
Okay, so we're going to, this has gone by so quickly, I think we're going to have to wrap things up a little bit. And as you know, we're called the Hat Rack because during every episode, we like to try and give physicians in practice something to hang their hat on, a practical advice, practical tips to maybe implement in their practice to help them to plan and implement their CPD in an evidence-informed way. So do you have any suggestions or some practical tips that you might give to physicians in planning their CPD that might be able to facilitate their well-being?
Yeah, thank you. I think, one big tip that we've already spoken about is just recognizing the value of it, right? And making a commitment to attending CPD. And I think, and asking around, asking people you trust which ones they would value. And I think that brings in, asking some of what is important to you, to see if this is something you want to attend. So, I say to people, make sure it's meaningful, right? Because that would hit one of those C's. Make sure that you actually make time for it so that you're not multitasking and you're trying to do a bunch of other things, but really I'm getting away and I can actually really, enjoy this. And then, while you're there, right, thinking about connections and, who do I know that I'm going to enjoy spending time with and who can I learn, get to know that I'm going to enjoy time with. And then I would say probably the last is once you come away, having sort of thought about that and having had a great time at a meeting, I would recommend my Tarzan rule. And this is a rule that I came up with, decades ago when my children were very young. We were watching that movie Tarzan. And I recognized that, when Tarzan holds on to one vine, he doesn't let the other one go. He doesn't let it go till he's got the other one in hand, right? So it's like, don't end anything without having one more booked. And then, I started off talking about this for holidays, suggesting that people, never end a holiday without having the next one booked. But now I just say, all the things in your life that you find useful, that you find, fill up your cup in some way, right? Don't end them. So whether it is, lunch with a friend, a game of tennis, a time at the spa, or an amazing CPD that you've attended, right? Do not end that one without having booked one more.
That's great. Well, we've just dipped our toes in this water, and it's been fantastic. Thank you so much for joining me on the Hat Rack. It's been an absolute pleasure to have you, and I know our listeners will love listening to your insights and gain the benefits of your wisdom and experience.
Thank you. It's been a real pleasure, and thank you so much for inviting me to join you today.
Well, that was a really interesting talk, I thought. Certainly, the summative points that she gave at the end related to planning your CPD so that you can make connections, and the Tarzan rule are awesome. Personally, I love the thought of paying attention to those 5 C's of resilience, or 5 C's that can help you in your well-being when planning your CPD. And I hope that maybe some of our CPD providers who are listening in will think about maybe we can structure our CPD around these things and ensure that we include some opportunity for calmness and opportunity for connection, making sure that physicians have the opportunity to cover those 5 C's in their CPD. So I think it was fantastic, and I really enjoyed talking to Dr. Gautam.
You've been listening to The Hat Rack, hosted by Dr. Bill McCauley from Continuing Professional Development at Schulich School of Medicine and Dentistry, Western University in London, Ontario, Canada. Technical assistance for The Hat Rack is provided by Patrick Barfoot, Technology Support Specialist at Schulich. Original music was composed by Cameron Bereznik. Please contact us with any questions, comments, or suggestions for future topics or guests. We can be contacted by email at thehatrack@uwo.ca. Additional episode information can be found online at schulich.uwo.ca/CPD. For The Hat Rack, I'm Kimberly Bukala, Educational Developer at Schulich School of Medicine and Dentistry, Western University, leaving you with something to hang your hat on.